NLN Nursing Entrance Exam Mock Test. Question 1. Which number is 10% of 40 in this digestive process item? Option A, 4. Option B, 40. Option C, 50. Option D, 30. The correct answer is option 10% means 10/100, so 40 times 10/100 equals 4. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 2. During a quick NEX review of a homeostasis item, which word is closest in meaning to brief in a patient education passage? Option A, lengthy. Option B, bitter. Option C, complex. Option D, short. The correct answer is option brief means short, so that choice matches the meaning in context. Lengthy means long, not short, bitter relates to taste, not length, and complex means complicated, not short. Question 3. After checking the choices in a scientific method item, which answer identifies the process moves water across a semipermeable membrane? Option A, a transcription. Option B, mitosis. Option C, exocytosis. Option D, osmosis. The correct answer is option osmosis is the diffusion of water through a selectively permeable membrane. Transcription copies DNA information into RNA, mitosis is cell division, and exocytosis moves materials out of a cell. Question 4. If a control group stem gives one clear clue, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, reminders can help patients remember appointments. Option C, appointments no longer need scheduling. Option D, patients cannot benefit from reminders. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Appointments no longer need scheduling is not supported by the passage, and patients cannot benefit from reminders is not supported by the passage. Question 5. When time is limited on a sample size question, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, convection. Option C, radiation. Option D, evaporation. The correct answer is option conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation, radiation transfers energy by waves, and evaporation is liquid changing to gas. Question 6. Given the information in an enzyme activity item, which probability describes drawing a red card from a set with 3 red and 5 blue cards? Option A, 8/3. Option B, 3/8. Option C, 5/8. Option D, 3/5. The correct answer is option probability is favorable outcomes divided by total outcomes, so the result is 3/8, simplified to 3/8. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 7. Suppose a similar pH scale item appears on test day. Which word is closest in meaning to concise in a patient education passage? Option A, brief. Option B, wordy. Option C, damp. Option D, timid. The correct answer is option concise means brief, so that choice matches the meaning in context. Wordy means using too many words, not brief. Damp means slightly wet, not brief, and timid means shy, not brief. Question 8. While working through a timed solution chemistry set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, nephrons. Option B, the villi. Option C, a bronchi. Option D, alveoli. The correct answer is option alveoli provide thin, moist surfaces where gases diffuse between air and blood. Nephrons filter blood in kidneys, villi absorb nutrients in the intestine, and bronchi carry air toward the lungs. Question 9. Before choosing an answer in a genetics clue item, which answer best explains the author's point? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. The exam has no time pressure. Option B, timed sets remove all content gaps. Option C, timed practice can build exam familiarity. Option D, comfort never changes with practice. The correct answer is option The passage connects timed practice with increased comfort. The exam has no time pressure is not supported by the passage, time sets remove all content gaps is not supported by the passage, and comfort never changes with practice is not supported by the passage. Question 10. A student sees the cell division idea on an NEX review. Which critical thinking response best fits this situation? A patient says, I feel better, so I stopped the medication early, in a health literacy passage. Option A. The statement shows a need for clearer teaching about completing treatment. Option B. The patient fully understood the instructions. Option C. Teaching is unrelated to medication use. Option D. A medication should always be stopped early. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. The patient fully understood the instructions does not follow from the situation. Teaching is unrelated to medication use does not follow from the situation, and medication should always be stopped early does not follow from the situation. Question 11. One bone support practice problem tests this skill, which milliliter amount equals 1.2 L. Option A 12,000 ml. Option B 12 ml. Option C 120 ml. Option D 1,200 ml. The correct answer is option 1 liter equals 1000 ml, so 1.2 times 1000 equals 1200 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 12. Several choices look tempting in a muscle movement item. Which word is closest in meaning to demonstrate in a patient education passage? Option A guess. Option B delay. Option C show. Option D hide. The correct answer is option. Demonstrate means show, so that choice matches the meaning in context. Guess means estimate, not show. Delay means postpone, not show. And hide means conceal, not show. Question 13. For this nerve signal nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A platelet. Option B hormone. Option C antibody. Option D enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Platelet helps clotting, antibody targets antigens, and enzyme speeds chemical reactions. Question 14. In a short endocrine message practice STEM, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A, pictures make written instructions unnecessary. Option B, long paragraphs are best for patient teaching. Option C, clear formatting helps readers understand health information. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Pictures make written instructions unnecessary, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage, and headings reduce the value of information, is not supported by the passage. Question 15. Among the choices in a glucose regulation item, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A 5. Option B 8. Option C 44. Option D 26. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 16. Using the facts in a chart reading question, which sum equals 2/5 plus 1/10? Option A 1/2. Option B 3/10. Option C 1/4. Option D 4/5. The correct answer is option. The denominators are already the same, so add the numerators, 8 plus 2 equals 10, then simplify to 1/2. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 17. Based on the clue in a ratio setup item, which word is closest in meaning to emphasize in a patient education passage? Option A minimize. Option B borrow. Option C stress. Option D divide. The correct answer is option. Emphasize means stress, so that choice matches the meaning in context. Minimize means make less important, not stress. Borrow means take temporarily, not stress. And divide means split, not stress. Question 18. Consider this high-yield unit conversion concept. Which answer identifies the cell division that produces gametes? Option A, diffusion. Option B, translation. Option C, mitosis. Option D, meiosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Diffusion moves particles down a gradient, translation builds proteins, and mitosis produces identical body cells. Question 19. Near the end of a percentage item review session, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, orientation should never include stories. Option B, a former patient stopped the program. Option C, personal stories can motivate people to participate. Option D, a volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Former patients stop the program, is not supported by the passage. And volunteer programs grow without communication, is not supported by the passage. Question 20. Across similar fraction item nursing entrance questions, which answer identifies the group that does not receive the experimental treatment? Option A, experimental group. Option B, conclusion. Option C, sample. Option D, a control group. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, conclusion is the final interpretation, and sample is the participants or items studied. Question 21. Since only one choice fits the mean score clue, which dose volume gives 750 mg from a supply of 250 mg per 5 ml? Option A, 3 ml. Option B, 15 ml. Option C, 7.5 ml. Option D, 30 ml. The correct answer is option. Set up the proportion 250 mg, 5 ml equals 750 mg x ml, so x equals 750 times 5, divided by 250 equals 15 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 22. From the information in a probability set item, which word is closest in meaning to frequent in a patient education passage? Option A, often. Option B, heavy. Option C, or rare. Option D, silent. The correct answer is option. Frequent means often, so that choice matches the meaning in context. Heavy means weighty, not often. Rare means not often, and silent means without sound, not often. Question 23. At a testing desk during a test strategy review, which answer identifies the solution with pH above 7? Option A, neutral. Option B, basic. Option C, acidic. Option D, hypotonic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Neutral describes pH 7, acidic describes pH below 7, and hypotonic describes lower solute concentration. Question 24. Inside a main idea science or skills item, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, distractions are always helpful. Option B, reducing distractions can improve study conditions. Option C, quiet rooms increase noise. Option D, students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage, quiet rooms increase noise is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 25. Through careful reading of a inference clue stem, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. The conclusion should ignore group differences. Option B. The conclusion may be too strong because another factor could explain the scores. Option C. Random assignment is never useful. Option D. Higher scores prove every student studied more. The correct answer is option. Without random assignment, group differences may affect the result. The conclusion should ignore group differences does not follow from the situation, random assignment is never useful does not follow from the situation, and higher scores prove every student studied more does not follow from the situation.